Well, 2015 is bringing promising medical breakthroughs that will help people live longer and look better and have better lives. What could be better? Dr. Kelly Powers is here with us right now. I would think that reversing the aging process is just like all anybody cares about.
Oh my gosh, right? Of course. For reversing the aging process, the fountain of youth question. Is it possible? Well, according to a study from Harvard University in New South Wales, they say it is. So they did a study with old mice, inoculating them with a certain protein. When they did this, within 1 week, they found that it actually reversed the aging process.
So, and it was like basically making their blood younger?
Yeah, well, so they saw muscle tone changes, increase in muscle tone, increase in heart strength, and even neurons in the brain developing. So really this has potential for Alzheimer's disease, potential for spinal cord injury patients, paralysis, even something near and dear to me, lower extremity sports medicine, all those things. I mean, the potential is really endless.
That is something that's going to continue. I know it. This whole notion of better blood tests, thank God, because anyone that has gotten a blood test, it is painful.
Of course.
And it's just emotionally trying, if you ask me. They tie you up and all this stuff.
Right, absolutely. Stress, the whole thing. Some people have a real innate fear of needles,
I don't blame them.
So this idea is that through just a simple finger stick that we can find all of the things we need. CBC, metabolic panel, the whole thing, just from a finger stick.
It makes sense. There's no need to take vials of blood out of you just to like test a drop of it. But I'm not a doctor. So ways to lower cholesterol, this is near and dear to me because I have high cholesterol and it is a pain in the neck. You worry about it all the time that you're going to have a heart attack.
Yeah. Well, so what we're finding now is that current modalities, statins, they've been around for decades. They've been great. They've done wonders. However, there's a new class of drug out called the PCSK9 inhibitors, right? So this drug class is promising to lower LDL, which is your bad cholesterol, even more so. So why is this great? Well, it's great because some people can't even take statins. They're actually intolerant to it. So this gives them an alternative option. And also some people, it's just not doing enough.
And there's so many side effects to these statins. Like I won't go near them. My cousin's on them and she's had so many problems with them. So this would be great if. And it's also something that you don't have to be on for the rest of your life, too, because that's also something you don't want to have to do. All right, so this I can barely say. It's microbiome manipulation in the gut. This is all gastrointestinal stuff.
Correct.
People have issues these days, though. You got to talk about them.
Absolutely. So the microbiome manipulation, right? This is all about changing the bacteria that's in our gut. So there's bacteria in all of us, right? And a lot of it's good, but sometimes it's opportunistic, meaning it causes infection or causes an inflammatory process. So right now what we're seeing is that very popular gluten intolerance. We've heard that around a lot, right? We've got IBD, Crohn's disease, ulcerative colitis. This potentially can change that. This is treatment for them.
I know so many people that have these. I mean, granted, half of us have self-diagnosed ourselves to have these things, but there's a lot of people that have issues with their intestinal gastro stuff.
Of course. So this shows a substantial promise for that, we're hoping.
This is also the year of mobile medicine. And I know, like, again, people self-diagnose and things like that, but you're really talking about, like, keeping track of your vital signs and things like that.
Absolutely. I'm calling this power to the patient. Obviously, a lot rests on us doctors, but it's nice to know patients actually have power now. They can wear devices, tracking devices. We've got the Apple Watch. We've got Fitbit. All those things help with data, real-time data, right? They could tell your heart rate, your pulse, your blood pressure. But not only that, it can give us storage, data storage, shows us long-term, this is your baseline, this is what you are in 6 months.
That's the important part. Not enough people have a baseline. I was telling that my nephew is diabetic. He has this app on his phone. He pricks his blood, and it goes through his phone to his doctor. His doctor automatically knows his reading. It's so amazing. I hope that kind of stuff continues forward. I have a jawbone. It just makes me feel bad about myself. I never hit any goal that I'm supposed to hit. It's terrible. Dr. Powers, this is all great stuff. Thank you so very much.
Thank you so much. Exciting year ahead.
Thanks.